expanded my passion about research. Used to be cardiovascular, but now more towards gender guidelines, garis panduan pengenalan masalah kesihatan. Will elaborate to us in depth in her talks today. But we do have these guidelines and gender expression without positions, and this has posed an ongoing dialogue with regards to medicine. What is gender? Okay, sure. And for the, so it was a question which I think our forefathers would laugh. Why would we? Now, in 2017, there was actually a remark paper by the Sex and Gender Women's Health Collaborative, who actually said that the terms sex and gender are often used interchangeably and incorrectly, both within and outside of the typical binary construct. Okay, I'm picking up these people not because I'm saying that they are right, but this is the discussion. This is actually the polemic when we discuss about gender. And furthermore, SGWHC, okay, says that the mission, their mission, integration of SGBM into research, health professions, education, and clinical practice. Now, studies of recent have logical clarity on how sex and gender should be analysed in practice when it comes to medicine. Okay? We're not talking about the philosophical of
تفرقنا من بعده تفرقا معصوما ولا تجعل اللهم فينا ولا معنا ولا من يسبقنا شقيا ولا محروما ولا مطرودا ربنا آتنا في الدنيا حسنة وفي الآخرة حسنة وقنا عذاب النار وصلى.
Our theme of choice, reproductive health and gender identity expression, underscores our commitment to fostering a more inclusive and informed society based on factual discussion. Reproductive health is a fundamental component of overall well-being, and as with any other branches of medicine, it encompasses far more than just the absence of disease or illness. It is also about making sure that individuals have good access to the necessary information, resources, and healthcare services that will allow them to make well-informed decisions related to their bodies, sexuality, and reproductive functions.
Let's discuss this openly. Put aside the emotions, because the impact will be to the younger generations and to the unborn child. That is where the impact is or are. So, we are here not just because of, we are USIMians and we have this integrasi ilmu nakli dan akli, but again, your views on this, I hope, do something about it. Not just a gathering of, old friends and academicians, but again, do something about it. If I can just preempt what we are going to do in this December. Last week I was at UMI, University Muslimin Indonesia in Makassar. Sometimes we can learn a lot from Indonesia, although perhaps some of you might disagree with me, but that's okay with me. When I went to the hospital is fully wakaf, and they have been exist since 50s. Wakaf is a different story, but what I'm trying to say is that one of the research that they proposed, I think they met Prof. Fadila, they met some of you last year. They did this research about kurma ajwa. They find out that, when I asked the dean, it's just like I'm asking a PhD student on Viva until I have to page myself, hey, this is a professor, not your student. I asked him, when the observation, I asked him, what is your sample size? What is the alpha? Is it 0.001 or 0.05? To the point I asked this professor. Then Saifullah said, Prof, ini bukan student Prof. Why I'm asking that hard questions like this? Because the finding is so fantastic is that they found out consuming ajwa dates, they can prolong the menopause process. It fertilizes the man and the woman. And if we go back to the Islamic studies, Islamic or in knowledge, Rasulullah SAW, has mentioned in his hadith about kurma. In the Quran, we have special dedicated verse in the Quran. So why aren't we using that knowledge? I was so amazed with the finding. That is what I want to understand. Is the finding just like sample size 10, 12, As a scientist, if you talk to me about research, first of all, I will ask your methodology. If your methodology is right, then I will hear your results. If not, I'm so sorry, I will not. Because to me, if the methodology is right, then let's talk about it. If not, it's just like sembang tepi jalan kopi, So, so I invited this group of scientists, medicine professors. They will come to USIM in December. I've asked to do a RTD, roundtable discussion, and I am discussing with the dean, inshallah, after this, to get some expertise, not just from FPSK, but also from other faculties. Now, ladies and gentlemen, fellow academicians, it is my hope that the meetings of intellectuals and academicians and also practitioners will help this agenda, not just for USIM, but also for Malaysia.
Actually, I asked Dr. Prof, is this event open to all? And he said yes, because it's the first time I heard about NHS USIM. So maybe you need more promotion so that more people can actually come into this event. And I also congratulate USIM because they're going to have hospital university, hospital pengajar, just recently announced in the budget by our PM. It's a huge hospital. It's going to be in Sedili, Kota Tinggi, I think. So we're going to move from Nilai to Johor, quite far from Nilai to Johor. Okay, Malaysia as a nation known for its rich diversity and its tapestry woven with the threads of various cultures, religions, and traditions. In this vibrant mosaic, it becomes essential to navigate conversations around reproductive health and gender identity expression with cultural and religious sensitivity and an appreciation for the nation's unique context. Pregnancy, for example, issues of family planning coverage is still low, issue of violence, issue of STI among women. We see more and more health. Health is actually the end product of all these issues. I will take, for example, teenage pregnancy. There is a combination of social issue, socio-economic issue as well, and health issue. But those who come into the clinic, actually the product, the end product. So I think it is not right. You just tackle the end product. We have to do the prevention part, the upstream, not the downstream. Otherwise, we can only treat, but the same cases will keep coming. The same problem will keep coming to our facility, but it's not the solution. So we have to do something in the community to empower people, empower community, so that they know what to do and they can handle this. Otherwise, we have a problem of looking at the end product of whatever the social reproductive issues among our populations. And to do this, we must have awareness to empower. You must have the basis in awareness, knowledge, education. So we have to educate our women, give them knowledge so that they are aware. After that, only they can go into empowerment. Because with that, they can know how to make the decision. They know how to make the right choice. They know where to get care. They know how to get advice, and etc. So, empowerment, this is one of the definition, just to share basically more or less the same things about strategic choices. But also it depends on so many other factors: economic, social, political, religious, cultural, and as issues is very much related to social and cultural issue as well as religious issue. That is a challenge to us. And the process of awareness will lead to greater participation, effective decision-making power, control, and transformation action. Meaning, when we have awareness, then we can empower them. When they empower them, then they can make a decision. Right? All right, let's look at the statistic from DOSM. Because, as I mentioned, our women are actually well educated. In this room, I think many women than men. In USIM, I think in most universities, we see the numbers, the proportion of females actually more than men. But how come that they still have issues in terms of empowerment for sexual reproductive health? Maybe the knowledge of RSS is not enough. This is one of the approach by WHO, even at the regional office. For example, in Thailand, they already started education, sex education in school. But in our country, it is a sensitive issue. We cannot mention sex education in school. The sex itself is a very, we'll say, taboo. So you have to find other terms. Sexual reproductive health is still sexual in front of the SRS. So we have to find other terms because it's still not widely accepted by our community to talk about sex openly or even sex education in school. That's why we have lots of resistance from KPN in terms of introducing sex education in school. And our teachers also are not comfortable. They are not comfortable to talk about sex education. Even in our family life, we don't talk much about SRS at home, even in at home. All right, so women achievement has surpassed men in education and attainment. This is from MGGI. And in terms of girls are consistently enrolling at higher rate than boys in primary, secondary school, even at tertiary level. So girls, women are well educated. So now I think they have the power to do more. And even our YABPMs has made commitment to, in terms of women leadership. And I think this is being proposed by the Ministry of Women. They would like to achieve at least 30% women in the leadership role, even in Parliament. This is a very huge challenge for us, especially for those in the top management. So decision is really made by men. Unfortunately today, talking about SRS also men. I think if women talk about SRS, I think it will be different. Now I'm talking about sexual reproductive health, women empowerment. I cannot 100% actually, I would say, menjiwai, that the word menjiwai. So, but that is important for women actually to make that movement. We need more voices of women, right? We will be supporting from behind. And men will be supporting from behind. All right. How to increase awareness? This is from perspective of our Ministry of Health. As I say, our strategy, program, activity, more or less the same, day in, day out, every year. However, because of this, the new things coming out, because we are actually trying to, the new government try to work more on the preventive and promotive care, and with the health white paper also, as you remember a few months ago, this health white paper was approved by the parliament, and one of the important components in that health white paper is about health promotion and prevention, and preventive care. This is the one of the focus. Even in 2 pillars of the health white paper mentioned about investment in health promotion and prevention. So the agenda National Malaysia Sihat is a national agenda. It is not the Ministry of Health agenda because it involves the whole ministries, and the higher level committee meeting chaired by Deputy Prime Minister himself. And this is one of the agenda focusing on improvement in health and wellness, work on the wellness, and also enhancing self-health management. This is empowerment management, but in different terms. So basically, this is going to be the agenda. Health white paper framework supposed to be implemented in the next 15 years. So in the next 15 years, well, I'm no longer in the service for that 15 years, only 1 year left for me. But we can see if this really the way forward, the pathway moving forward by the government is a very good investment, because you can only see the return of investment in health not right away. It can take times. You do this now, like what happened in maternal and child health. We invest after independent. Now we can see the result after many years. Same thing for vaccination. It takes time. But if you invest in public health, in primary care, in prevention and promotion, you will see the result. In fact, in many developed countries, they now make a U-turn because they know hospital care, curative care is very expensive. And especially if you're going toward aging society, aging nation, that's going to be more costly. Because aging society, elderly usually will have comorbid, and treatment of long-term care will need huge investment, huge funding by the government. So we are moving towards that direction. So we have to prepare for that. So this is also being taken up, and in fact, under EPU and World Bank, they are now developing the blueprint for, they call it aging, how do you call it? It's something to do with aging. And the blueprint will include activities or program by every ministry to prepare our nation towards aging society or aged nation. Thank you. All right. This is some other strategy. I think that's what I say. Minister of Health strategy is quite familiar to all. But nowadays, this poster and leaflet is I would say no longer not relevant, but still relevant in some areas. But to focus more on social media, we have to use the different platform. Now people are using, especially the young generation, they are no longer reading the pamphlet, they're no longer reading the leaflet, even they're not watching TV, they're watching Netflix. And most of the time they spend on handphone. So we have to use this platform to reach, because I think Malaysia is one of the highest penetration of mobile user. So this is one of the platform that we can use, and we have to make use of this. So the way we communicate, the way we create awareness, we have to try to use this media, and it's proven to be more effective. The other empowerment strategy, this is the things that we have been doing now, is already in place. Online health application many things we do it online. Self-testing instrument, I think this is widely available. This is some of the example. You have so many mobile or wearable devices. If you really empower them, they know what actually to do for the healthy lifestyle. Virtual care, we have this virtual care. So if women is empowered, they know what to do. So they can access, they can use several medium to get advice, help, but still they need to be empowered. They can decide, they know what to do. The platform is available. And now I'm come to the importance of awareness and empowerment. What time should I stop? According to time, tentative. All right. Importance of awareness and empowerment. Why is it important? One is because for the physical health. If we have access to information and services related to family planning, pregnancy, childbirth, sexually transmitted infection, it will help towards improving physical health. And also, if we can have an informed decision about their reproductive health, it will help in terms of deciding for their own health. And these all can lead to the safer pregnancy, reduced maternal mortality and infant mortality, better overall health and well-being of our women. And don't forget, this is also can prevent the spread of sexually transmitted infection, STI, and also unwanted pregnancy. I showed a figure later, the trend of some of these STI and also unwanted pregnancy among teenager in the country. Another important why this empowerment for SRS is important for the mental and emotional well-being. It helps people to make choices that align with their personal goals and values, and also reduce anxiety and stress, and this will give positive impact on mental and emotional well-being. And also for the gender equality, it has impact on the child health, ability to protect STI, family planning, as also violence against women. If they have a good knowledge, they can have informed choice and access to RIT services, not only for men, but also for women. Another thing is on the population growth, and of course family planning. But bear in mind, I remember what happened to China. China have a very strict one-child policy, and what happened? Meaning you cannot be too extreme. And also Singapore facing the same thing because people don't want to get married, so they don't want to have a child because it's very costly. Now they have an issue, the population is not enough, so they have to get invite foreigners, and that this is not good for the country. And also for the economic development, if you have improved living standard and reduce poverty, family, of course, it will ensure that we can invest more on education and health of the children. And also, if we empower individuals to make informed reproductive choices, it can contribute to economic development. In fact, in the labor force, women in Malaysia almost half, almost 50-50, more than half. The proportion women are in labor force. I mean, they have contributed a lot to the national economy, to the growth of the nation. So we don't want SRS is going to be a big issue because it will stop them from being reproductive and be productive, reproductive and productive. So because they have to play a big role in nation building as well. So you cannot depend on men alone. Women and men have to work together. So this is important because if we take example from other developed nations, see, you may want to make the progress, women have to play the role, have to play an important role. But the challenge is because women, because of the characteristic of women, they have many challenges. Their mothers at the same time, their girlfriend, their wife. There are so many things. They play many roles as compared to men. Sorry, men, I have to be honest here. So because of that role, sometimes they have to make a decision. They can't proceed, they have to stop working. So this is not good, especially if they are very knowledgeable, expert in certain set of field. It's not easy. Investment in capital investment is not something we can do in a short period of time. That's why to be developed nation, you have to invest in human capital. And human capital means men and women equally. Right? After this, I think women has to praise me and the belanja lah. Alright. Some of the impact on if we can have a good maternal sexual reproductive health, I think we can look at our achievement for the maternal and child health in terms of perinatal and maternal perinatal death and death of the children. We can also look at our family planning, but I think the coverage is still not good. The challenges is some of the issue, for example, maternal child health. We cannot reduce it further. It's now still plateauing because of many issues. So in the future, minister have to play a bigger role in terms of how to tackle this preventable death, for example.
For the first talk, I would like to invite Topuan Dr. Safra Jaafar to deliver her talk entitled Guidelines for Handling Gender Health Problems in Health Clinics. But before that, I would like to briefly introduce our speaker. Topuan Dr. Safra Jaafar served as an adjunct professor of public health at the International Medical University in Malaysia. At IMU, she contributed to the development of the MBA in the Healthcare Management Program. Prior to her role at IMU, she held the position of Director of the Family Health Development Division at Ministry of Health Malaysia from 2007 to 2017. During her time in this role, she played a pivotal role in reforming primary healthcare delivery in Malaysia, aiming for equitable care distribution and universal health coverage. She introduced policies that emphasized primary care, a life course approach, and gender-based family health services. She also oversaw the integration of primary care with secondary and tertiary care, involving both the public and private sectors. With extensive experience in global healthcare, she advised the WHO on primary care health systems and policies, representing Malaysia in various United Nations and UNICEF conferences. She is currently a member of the Family Health Subspeciality Education Subcommittee and has a very impressive background in international organizations. With that, I would like to invite our speaker, Topuan Dr. Safra Jaafar, to deliver her talk. The stage.
And for those who have gotten involved in this, how do they progress? Actually, from the study that is being done by Marianne Libet, and I think the same study that Prof has showed just now, what she said and what she found is that for those who has gone or who has already involved in this, I don't know what to say the word, involved or got into, chose their life into, almost 60% of them will progress, will grow into transitioning and hoping to do some gender affirming treatment. In other words, yes, I've chosen this path, and 60% of them say I will proceed. 13% of them, however, there is that hope, right? 13% of them has a history of detransitioning. So in other words, these figures or these statistics may be important for us, because if you have a community of about 100 of this group, you hopefully there's that 13% of that 10%, and hopefully a growing number of them who will detransition. And this is the hope that we have, that the number will grow. And I think it only depends on what type of intervention that you will institute at the policy level, that you will see a lot more detransitioning that can happen. And even, and I think this paper also saw, and I hope it's the right thing that I quoted, that only 1% expressed regrets. So in other words, they are into it and they want to proceed, because I think the societal norm within them, within that group, has been very strong, to fix.
Transgender yang juga dikenal sebagai maknya, bapa, dan kalau kita sebut pondan ni makin marah lah, tak disukai, tetapi yang ada dalam masyarakat kita. Saya tidak berhasrat untuk cerita berkenaan latar belakang ni secara panjang, tapi cuma dari segi datanya kita dapati bahawa pertambahan kepada transgender maknya ini, kalau mengikut kajian, telah mencapai 80,000 bilangan mereka ni. Tetapi kita tidak ada data yang tepat kerana tidak ada pendaftaran rasmi di Malaysia, kerana komuniti ini tidak diiktiraf lah dari segi perundangan. Cuma daripada komuniti ini 80%-nya beragama Islam, dan daripada mereka ini 80% mereka ini terlibat dengan aktiviti saya namakan sebagai seks sonsang lah. Dan wajar juga untuk kita tengok dari segi apakah pandangan Islam itu terhadap komuniti maknya. Dan saya difahamkan Dr. Izwan pun akan kupas perkara yang hampir sama. Cumanya di sini kalau saya cuba cari berdasarkan pada hadis Nabi SAW, terutama daripada ayat Quran lah, merujuk kepada kisah Nabi Lut, tapi dalam ayat ini dia fokus berkenaan dengan kaum Nabi Lut yang mengamalkan seks sonsang, yang mana mereka ada keinginan terhadap sesama jenis lelaki kepada lelaki. Jadi komuniti transgender ini dia sebahagian daripada ciri tersebut. Walaupun terdapat ada yang cuba menafsirkan ayat ini dengan tafsiran yang kita istilahkan syaz. Syaz ini adalah tafsiran yang janggal, yang mana mereka mengatakan bahawa kaum Nabi Lut itu diazab oleh Allah SWT bukan kerana perbuatan seksnya, tetapi dikatakan sebab tidak menghormati tetamu. Tetapi ini bukanlah satu tafsir yang diterima, kerana ayat ini jelas menyatakan bahawa patutkah kamu melakukan perbuatan keji yang tidak pernah dilakukan oleh seseorang pun daripada penduduk alam ini sebelum kamu. Sesungguhnya kamu mendatangi lelaki untuk memuaskan nafsu syahwat kamu dan meninggalkan perempuan. Bahkan kamu ini adalah kaum yang melampaui batas.
Jantina. Apa pandangan Islam tentang isu LGBTQ sekarang, dan bagaimana untuk kita menghormati dan kasih sayang antara manusia tetapi tidak menyokong ideologi yang bertentangan dengan kepercayaan kita? Silakan.
Assalamualaikum warahmatullahi wabarakatuh dan salam sejahtera. Terima kasih kepada Dr. Khadijah selaku moderator pada hari ini. Sahabat saya Mr. Eugene, seterusnya saudara Nasir dan Devin Tafrina, dan tidak lupa juga kepada barisan penganjur, Prof. Rafida, Tok Puan, Safura, dan semualah jemputan-jemputan dan para peserta yang dirahmati Allah sekalian. Baik. pendekatan ataupun pendirian kita berhubung dengan isu LGBT. Dalam masyarakat sentiasa ada dua golongan yang bertentangan. Ada yang mungkin dianggap sebagai ekstrim dan ada juga yang mungkin dianggap sebagai terlalu terbuka. Dan kalau kita lihat dalam masyarakat yang dikatakan sama ada pendekatannya konvensional ataupun kita kata quite ekstrim itu, kumpulan yang kedua yang mungkin terlalu open, yang setengahnya dianggap sebagai ultra liberal. Jadi dengan dukungan daripada aspek human rights, maka menganggap perlakuan LGBT ini adalah sesuatu yang menjadi hak individu. Jadi tak boleh kita nak customize ataupun kita nak standardkan, oh ini perkara yang perlu dihalang, kerana itu merupakan hak pilihan setiap individu. Maknanya ambil masa. Dan baru-baru ini kalau tuan-tuan puan-puan perasan, ada satu video yang viral yang dalam satu soft itu kelihatannya ada lelaki dan seolahnya perempuan dalam satu soft. Saya tengok video tu, saya kata, ni video mana pula ni? Ujung-ujung ada pula muka saya. Rupanya program kami yang baru dibuat di Cameron Highland beberapa bulan lepas. Penatnya tak habis lagi tapi video dah viral. Okey, saya nak jelaskan begini. Dalam kelompok transgender ini, yang hijrah itu yang nak berubah ke arah yang lebih baik, ada yang berpenampilan kembali seperti lelaki. Tapi ada yang merasakan, oh saya ni rasa diri perempuan, jadi kalau saya nak berhijrah, saya mesti menutup aurat lebih sempurna. Jadi itu yang ada mula memakai tudung dan bila solat pakai telekung. So bila semayang, kita kata tak apalah, sebab mereka itu dari sudut hukum jantina asalnya adalah lelaki. Jadi hukum ibadah berbalik kepada jantina asal sebagai lelaki. Sebab itu dalam program kita memang tak war-warkan sebab kita jaga privasi peserta. Yang hebatkan video itu peserta juga. Itu di luar kawalan kita. Sebab dia nak mungkin untuk konten dia ke dan sebagainya. Tapi nak ceritanya ada hikmah. So kita kata dekat JAKIM, ini usaha yang kita buat. Kerana usaha perlu dilakukan, hidayah milik Allah Subhanahu Wa Taala. Yang ketiga, kesedaran kesihatan. Yang ini kita panggil pakar-pakar perubatan, pakar HIV daripada KKM untuk menerangkan risiko kalau melakukan kita kata hubungan sejenis ada sudut mendapat virus HIV. Yang keempat iaitulah motivasi dan kerjaya, dan yang kelima aktiviti outdoor ataupun LDK, latihan dalam kumpulan. So kita ada beberapa games sukaneka kita buat, kadang-kadang tarik tali. Saya ingatkan mereka, anda ni asalnya apa? Sebab tu bila makan, memang kita bagi makan banyak. Sebab dia makan macam orang lelaki dan dia pun lelaki juga asalnya. Okey? Jadi bila tarik tali itu saya kata siapa yang tarik 2 kali dia menang. So tarik kali pertama tim JAKIM Jabatan Islam Pahang menang round pertama. Round yang kedua tim Maknyah menang. So kena ada final round. Round yang ketiga kami hampir nak kalah, Mujo menang. Saya kata malu kalau kalah dengan tim Maknyah ni. Mereka pula masa mula-mula tarik memang kontrol lah. Tarik. Ujung-ujung dia pun nak menang juga. Tarik. Keluar suara asli ni. So bagi saya berbalik kepada soalan Dato' Khadijah, maksudnya apa yang kami usahakan adalah pendekatan dakwah dan bimbingan. Sebab tu saya kata kalau kita ada kawan-kawan LGBT, jangan sisihkan mereka. Kita dekati, kita bina repo dan kita gali informasi daripada mereka, dan kemudian apa yang boleh kita tawarkan. Sebagai contoh, ada satu kes seorang maknya umur 27 tahun. Dia kata, saya nak jumpa ustaz, boleh di mana? Masjid Besi Putrajaya. Saya pun tanya kenapa, dia tanya nak jumpa kat mana. Rupanya bila datang ke masjid dia pakai tudung. Sebab apa? Mungkin nak jaga ialah kesopanan dan kesusilaan. Dan kalau kita first time jumpa, kita tak kata dia sebagai lelaki sebab memang dia agak cantik, ada rupa. Okey, dah macam perempuan betul dengan lipstick apa semua, dengan tudung yang ayu sopan macam Nilofa. So dia bawa satu surat daripada pakar perubatan. Dia kata, Ustaz, saya sudah diagnosed as a gender dysphoria. Dan sekarang saya nak surat daripada JAKIM pengesahan untuk boleh saya buat pembedahan jantina di Thailand. Saya kata kami JAKIM tak keluar surat sebegitu. Dan saya suggest pada dia kalau boleh pergi jumpa pakar perubatan, kalau nak cepat pergi PPUKM sebab ada MDT, Multidisciplinary Team. So ada pakar ONG, ada pakar psychiatrist, ada pakar endocrine. So buat beberapa test, hormon test, apa lagi kromosom test dan genetik ke sebagainya, terpulanglah. So bila dia pergi buat test tu, sahabat di sana telefon saya, Ustaz, walaupun dia dah makan hormon estrogen daripada usia 14 tahun, maybe daripada pil-pil perancang yang dia ambil itu, until now, umur dia 27 tahun, tetap hormon yang dominan adalah hormon testosteron. So menunjukkan apa? Lelaki, kromosomnya 46XY. So kita jangka dengan result itu dia tak pergilah ke Thailand. Selang 3 bulan saya jumpa dia balik, Ustaz, saya dah potong. Allahu Akbar. Bermaksud dia pergi juga ke Thailand buat pembedahan jantina. Dan dia nak pergi umrah. Dan dia kata, boleh tak JAKIM keluarkan surat, saya nak tunaikan umrah sebagai seorang perempuan. Kami kata kami tak keluar surat sebegitu. Jadi inilah di antara perkara-perkara yang saya katakan, Islam ini walaupun di sana ada pendekatan dakwah dan bimbingan, tapi tidak kompromis isu prinsip hukum. Ini yang perlu kita faham bersama. Dengan itu, saya habis di sini dulu. Wassalamualaikum warahmatullahi wabarakatuh.
Terima kasih tuan. Menarik ya. Semua orang mahu pengakhiran yang terbaik. So insya-Allah ya, kita punya pendekatan adalah pendekatan yang rahmah ke arah ya, supaya semua kita dapat pengakhiran yang terbaik. Jadi we move on ya to Mr. Yuji. Okay. My question is, Christianity is also an Abrahamic faith, and I'm sure the values that are taught like caring and respecting others are also similar. I'm curious to know what is Christianity's view on LGBTQ. And in the West, I've also heard that some churches are pro-LGBTQ. How is it in Malaysia?
Okay, thank you. Terima kasih kepada Nganjo, the organizer, for having me here, and also to meet with old friends and some of you. I think the question has two parts. Firstly, the situation in the West and what is perceived as Christian, and the situation here in Malaysia, the Christian community view here in Malaysia. Number one, regarding the West, I just want to say this, and ini perkara yang perlu ditekanlah. The West is not Christian. Alright, let me say it again. The West.
Nama panggilan saya daripada dulu Amy. Tapi arwah mak saya pun waktu dia sedang pada koma pun dia panggil saya Amy. Tapi jabatan pendaftaran tersalah letak nama saya Muhammad Nasir Abu Bakar lah. Okay, so sebenarnya tak ada siapa-siapa yang untuk mengubah saya, untuk paksa saya mengubah penampilan. Saya buat di yang anda nampak saya sekarang ni, saya sendiri, diri saya sendiri. Tak ada siapa-siapa yang nak ubah daripada JAKIM ke daripada Ustaz Izzuan ke apa ke, tak ada. Saya pernah lupa. The best. Dah lama saya tak talk, dah bertahun, sebab saya masih lagi stigma pada masyarakat. Kadang-kadang ada lagi stigma pada komuniti saya sendiri sebab dengan penampilan saya, mungkin dengan penyampaian saya lah. Biasalah manusia ni berbeza-beza pendapat. Okay, itulah macam apa tadi moderator?
Cerita dia sharing. Macam mana Amy ubah penampilan daripada dulu waktu kepada sekarang?
Saya okey. Saya ubah penampilan waktu saya balik umrah pada 2016. Saya ditaja oleh Persatuan Insan Pahang lah, dan disokong oleh Ustaz Izzuan, Prof. Rafida, USIM lah, dengan Ustaz Izzuan semua. Prof. Rafida orang pertama daripada Jabatan Agama Islam di Pahang, Ustaz Nasaruddin. Kedua, Prof. Rafida dengan Ustaz Irwan dan Marlia, saya ingat lagi. Yang ketiga, Ustaz Izzuan, dan seterusnya Ustaz Hanafi dan lain-lain Ustaz lah. Okay, so saya balik pada umrah tu, sebelum saya nak pergi umrah, memang saya seperti yang anda nampak di media sosial, yang diorang wawarkan tu, saya penampilan dengan 36 kaki saya, dengan penampilan saya tu semua. Tapi saya pergi dengan umrah, Allah tutupkan aib saya dengan body saya yang saya tak buang lagi implan saya di dada, tapi Allah tutup aib saya dan Allah bagi banyak keistimewaan pada saya. Bila saya balik pada Malaysia, saya 2 minggu lebih saya buat keputusan, apa perlu aku buat lepas ni, sebab aku dah ada pangkat apa. Allah dah bagi aku keistimewaan, kemudahan kat sana. Padahal dalam hati ni macam-macam bermain, macam-macam bercakap. Kita buat dosa. Saya buat dosa banyak, bukan kita. Saya cerita pada ini diri saya sendirilah. Saya buat dosa banyak. Saya dengan tak semayang. Dulu kecil semayang lah. Lepas tu saya lupakan semayang. Saya ada yang benda saya ingat, ada benda saya tak ingat. Lepas tu puasa tak ke mana, dengan apa semua macam ni. Tapi tanggungjawab saya pada mak bapak saya tetap jaga. Bila balik pada situ itulah, dalam masa 2 minggu lebih saya buat keputusan, saya tak nak duduk kat Kuantan. Dulu saya duduk Kuantan. Saya berhijrah daripada Kuantan balik ke kampung dalam 2016 lepas saya balik umrah. Saya duduk kat situ, saya kata aku dah penat dah tak nak. Benda semua aku dah rasa. Saya pun dah depan Kaabah, saya dah bercakap aku nak jadi yang terbaik dari yang terbaik. So ini istiqamah. Saya cakap macam tu pada diri saya sendiri. Alhamdulillah, saya cakap dengan rakan milik saya, serumah saya, saya kata saya nak duduk kampung. Tapi bila dalam pada masa sama, dugaan tu tetap ada. Dengan orang ni telefon, mengajak kita dating, candlelight dinner kan, macam tu lah. Kau faham je lah kan. Tapi itu dugaan. Bila saya belajar sikit-sikit dengan bila program Mukayam, saya orang yang adalah kat situ. Daripada yang kedua, pertama saya tak ada, yang kedua sampai yang ke sekarang ni lah, saya ada. Macam mana cakap lah, itulah saya buat keputusan memang balik kampung. Saya teruskan kehidupan saya sehingga hari ini. Dan dalam kehidupan saya cakap, selagi kita nak jadi baik, macam-macam dugaan. Walaupun saya macam ni, dugaan macam-macam tu. Allah saja yang tahu. Orang yang tengok, dia cakap ini. Tapi sebenarnya terlalu banyak. Hanya saya sendiri yang mampu melawan, insya-Allah. Semoga dia dekat dalam ni doakan ke perhijrahan kami dan kawan-kawan kami di luar sana menjadi yang terbaik lah, insya-Allah.
Okay, so we have transgender men, we have transgender woman or girl, and we also have many definition, of this. I think those are the important things, area. We have also term that is referring to the sexual orientation issue, like lesbian, gay. That means that female attracted to female, men attracted to men, which is considered lesbian and gay respectively. Bisexual is that means that they're attracted to both men and women. And then they have asexual, that means they are not considering sex as very important in life. I come across few of them. There are men who are success in their business, but they are not interested in sex at all. But they actually function very well. They don't have girlfriend, they don't have wife, so they actually very happy with their life. Okay, pansexual actually a man who attracted to people of all genders, and expression. Queer, that means that they actually thinks that their sexual orientation actually is outside the societal norms. And straight is what we refer to call it being heterosexual. So make the classification more easier. So I think we can classify into sexual and gender. Under the sexual we have identity and role. Under the gender we have gender role and gender identity. It's very easy if we look at this domain. Because sometimes this topic about sexual orientation can be very confusing. So when we refer into sexual identity, basically it means that how actually the person sees his or her sexual identity. That means that whether he is male or female. But on top of that, they have what we call it sexual role. Sexual role is what is the role that needed for the person to be involved in sexual activity. For example, let's say sexual role of female or of a wife, istri, they are supposed to be so-called receiving, and man actually is giving. So the woman actually is expected to be quiet, so-called quote-unquote quiet, passive. They are not considered their role as very active.
Of gender identity information guiding the correct way, so they will be better in guiding the way. And both the cooperation and mutual agreement between parents also imperative. Okay, the role of father, the role of mother, and if you have any disagreement between father and mother, don't show that disagreement in front of the children, because this agreement or any misunderstanding any verbal argument, or sometimes domestic violence also, we create bad influence toward the children. And then the knowledge of parenting fathers, and this parenting knowledge will help with the gender identity information. And if a father pride towards have a pride in their child's success, and the closer attachment between father and son will help the son to have the correct gender identity expression, and also the good mental health of father will help the father to be able to play a role as a father, because it that with poor mental health, they could not have a good judgment in bring up their children properly.